Hello, and welcome to the Healthy Living Show. My name is Megan Copeland. I am today's host, filling in for Debbie Lyons. I'm the marketing manager for Hilton Head Regional Healthcare. And today we have Dr Chopade, who is a neurohospitalist with Hilton Head Regional Healthcare. Welcome.
Thank you, Megan. Thank you for having me.
Thank you for joining the show today. First of all, would you tell us a little bit about your background and experience?
Absolutely. Well, first of all, thank you for having me. We just moved here from Charleston, South Carolina, and we love it here. The family has moved to Bluffton, and I've started working at Hilton Head. I came to the United States from India. That's where I'm originally from. Lived in the United States for almost 20 years now.
Wow.
And then did my medical schooling at MUSC in Charleston, South Carolina. I continued there, completed my residency in neurology at MUSC as well, and then did a one-year fellowship in epilepsy or neurophysiology. So I've been in Charleston for almost 9 years, and then recently moved to Hilton Head.
That's great. And how do you like the Hilton Head area?
Oh, we absolutely love it. The family loves it here. I have 2 young kids, and they love the beach. We have lived in Charleston for such a long time, and then moving just a little bit down south to the Hilton Head area. We love it. People have been very kind, very welcoming in this community. I have great colleagues here at Hilton Head Hospital, so I'm really excited to be here.
We're really happy to have you. And so are you working at Coastal Carolina Hospital as well?
I do. I cover both hospitals, Coastal Carolina Hospital as well as Hilton Head Hospital. I'm usually at the Coastal Carolina Hospital in the mornings and then come here sometime around 11 in the morning, and then I'm here the entire day. A neurohospitalist is a neurologist who takes care of patients in the hospital setting. You can have neurologists who take care of patients in the clinic setting where patients have neurological issues. They come and see the patients, they come and see the doctors in the clinic setting, but sometimes patients are just too sick and they need to be hospitalized. And if they have neurological issues, especially something like stroke or seizures, they would be admitted to the hospital, and that's when I would take over. I would be treating those patients who are in the hospital.
Okay. And so hospitalists are also in the hospital as well. So how do you guys work together to take care of a patient?
That's a great question. The hospitalists are taking care of the patients in the hospital, and they are managing everything from high blood pressure to diabetes and any of the non-neurological issues. Of course, they can take care of the neurological issues as well. My focus is more on the neurological part of the equation. My focus will be on acute treatment of strokes and seizures, or something like GBS, Guillain-Barré syndrome. You'll have patients come in who have had Parkinson's disease for a long time, and then they suddenly feel too sick where they may not be able to take care of themselves. Patients like that would be in the hospital. They would be admitted to the hospital, and that's where I would come in. So a hospitalist would take care of any of the non-neurological things, and I would focus more on the neurological things.
Okay. And then once someone is discharged from the hospital, do you no longer communicate with that patient, or do they see a neurologist in an office setting, or how does that work?
So any patient who is admitted in the hospital, it's obvious that they were sick at some point where they needed hospital care. And after they are discharged, it's very important that they follow up with their primary care doctors as well as their neurologists in a clinic. It's very, very important. The last thing we want is patients to get better in the hospital and not have an appropriate follow-up, and then they might get sick again and have to come back in the hospital. We are going to do everything we can to minimize that possibility. So being able to have follow-up appointments with a neurologist in a clinic setting is paramount. It's vitally important, and we will facilitate that. We'll help patients get those appointments earlier, sooner rather than later.
Right.
And then I'm always available to my patients. If they need to call me and have questions, I'm always available. I may not be able to see them in clinic at present, But if they need recommendations, if they want earlier appointments, we will do everything in our power to facilitate that,
That's
to make
great.
that possible.
Yeah, so it's kind of a continuum of care
Absolutely.
from when you're in the hospital and then when you leave, and you're always
Absolutely.
going to be taken care of.
Absolutely.
So-
And that continuity of care is extremely important. Any neurologist, any neurohospitalist, any hospitalist will tell you that if that continuity of care is not there, that will lead to poor outcomes, and that's what we are trying to avoid, because we want patients to have continuous care. If they were sick enough to come to the hospital, that means they need care after they're being discharged.
Right. And so we talked a little bit earlier about some of the types of patients that you see. Can you talk a little bit about some of the patients that you see and the problems that they have?
Absolutely. Well, as a neurologist, my primary concern would be something like stroke. And stroke is one of the most unfortunate disabling conditions that is very prevalent in the South in general, and especially in South Carolina. And stroke is one of those things that has to be treated very emergently. It is an emergency. And the reason for that is because the interventions, the treatment options that we have are limited by time. One of the most common treatments for stroke is a medication called TPA, tissue plasminogen activator, and that medication can be given only within 4.5 hours of symptom onset.
Wow.
So if a patient comes to me 5 hours after their symptoms started, I cannot give them that medication, so they have missed that opportunity for treatment. Another option would be something like a interventional thrombectomy, where they do an intervention where they put a catheter through the blood vessels that goes up to the brain and removes if there is any clots that may be there,
Okay.
any thrombi that may be there that's blocking blood flow to the brain. And again, there is a time limit, a time frame in which we can do that procedure. If a patient comes to me after that time frame, unfortunately, there is not much that we can do.
Right.
So stroke, I want everybody, if the only thing you take from this is that stroke is an emergency. I don't want them sitting at home with weakness of a hand on the right side, weakness on the left side, weakness on one side of the body, having a facial droop, having double vision, things like that. I don't want patients to just sit at home and expect it to, or hope that it would just go away. Please have it checked as soon as possible. So that's my primary concern, stroke management, which has to be done within a certain time frame. The other neurological issue that we see very often is seizures. Again, seizures are abnormal, excessive brain activity. Our brain is always active, but when that activity is excessive, it's not within our control. It's uncontrolled brain activity. And seizures are often a symptom of something else. And so a patient having seizures needs that evaluation to find out how not only to treat the seizures, but what is causing the seizures.
Okay.
And that's why having that evaluation for seizures is very important, because you not only have to treat the seizures, but also treat the underlying cause of the seizures.
Right.
If the seizures continue for a long period of time, they can cause permanent damage to the brain. And that is why also seizures are a medical and a neurological emergency that need to be treated acutely.
Okay.
So another important point to consider is that if a patient, if a family member, if a friend is having multiple seizures and they're not coming back to their normal self, please don't wait and hope or expect them to just get better. Please have them evaluated as soon as possible.
And in that case, they would come into the emergency room?
That's exactly right.
Okay.
They would come into the emergency room, we would give them medications to stop the seizures acutely, but then they would get more testing done to figure out what is causing the seizures.
Okay.
Start them on the appropriate medication, check their blood levels if they are already on medications, find out if the medications are appropriate for their type of seizures. Seizures are not one type, there are different types of seizures. Some
Right.
seizures come from one particular part of the brain, other seizures involve the entire brain. We need to figure out what kind of seizures they are, what are the triggers, treat it appropriately, and treat the underlying cause.
So it sounds like to me you have a lot of different cases and every person is different and
Absolutely.
you're trying to figure it out. That's why they say
Exactly.
medicine is a science.
It is, and an art.
And an
Medicine
art.
is a science and an art, because every person comes with their own unique challenges, and we have to address all those things. There's no one diagnosis and one medication.
Right. Okay, we'll be right back to continue our conversation with Dr. Chopade. Thank you for tuning in.